Hello and welcome to Podiatry Practice Mastery. My name is Don Pelto, and today I have Mo or Maureen here with me, and we're going to be talking about billing. And Mo, thank you for joining.
Thank you for having me, Doctor.
You're welcome. You don't have to call me Doctor. You can call me Doctor.
Okay. Yes, I do. Yes.
So the idea for this, or the thought for this episode, in getting Maureen to talk about this is, there was a patient, or actually a doctor, that reached out to me, and he was been in practice for a while, and he was struggling because he went through a number of outside billing companies and he was having a hard time finding someone. And so I guess the focus here would be on if someone's just starting out, if they should just do it in-house or send it out, and then how do you really find someone? Kind of what do you look for? So tell me, first of all, though, Maureen, a little bit about yourself, your background.
Well, I've been doing billing. The billing service is a multi-specialty billing service. It has been around for 30 years. I've been doing it for 20. I know most of the specialties in the group. And if a physician is first starting out, they really should reach out to somebody, either an employee or another physician in their specialty, that they should approach them and ask them, who's doing your billing, if you have a billing service. Usually if somebody's starting off in a private practice, I wouldn't advise it, especially now. So, but if a physician that you're having a problem with right now, if he's not feeling confident with his billing service, he has to ask himself a couple of questions. First of all, say for instance, if his revenue, I'll say, is $45,000 a month, and he's getting less than that. Or if the patients are calling the office complaining about their bills or being billed, that is not a good sign unless the billing service calls, and we sometimes call ahead and say, so-and-so called and complained about her deductible. She's furious. She doesn't want to pay it. So we call in advance just to give you a heads up. So we don't want the doctor we really don't want the doctor to get involved in any part of patients complaining. You have enough to do with dealing with patient care and the demands, and now especially with all the restrictions. So as I said, a billing service takes all the guesswork out of what you are doing. And when you pick a billing service like ours, you should also be connected with the person that does this, like the account manager for your group. Let's say, for instance, it would be me. I know all about podiatry. So I would go and meet with you, meet with your staff, make sure we're compatible, we're comfortable with one another.
That's all right. The dog is fine.
We're comfortable with one another, and I better be talking your language.
Yeah.
For instance, when I had met your office manager, we were both talking the same language right along, and the problems that were involved. So that's really the first thing. The second thing is, a lot of billing services promise you the moon, and a lot of physicians pick by the percentage of what they're going to be billed by the month. Now, there's several billing services out there that bill 3.5%. Say, for instance, I'm just going up podiatry again. Then you get the bill at the end of the month. Well, it's 3.5% of what they collect. There's the clearinghouse fee, which is standard. There's your mail, which is standard for all the patient statements. And then they charge you for every claim that they have to resubmit back because a referral is missing, or the patient's insurance changed and the office didn't update it. And also, I know several billing services that when they send back an appeal, they charge you $7 an appeal. So You're looking at the end of your month end bill and you're seeing, gee, they were supposed to only charge me 3.5%. So with CHM, we just bill according to your specialty. I would bill a flat rate, say 8%, the clearinghouse and the statements. And the only time I would charge extra is if, say, for instance, you got into an audit or Medicare or Blue Shield requested 25 records, and it does happen lots of times. And that's extra time, extra paperwork. But I would work in conjunction with your office.
Yeah, so I just want to point out what you said. I think is something really important. If those are starting out, or those that have been in practice and you can't find a good biller, you probably have friends within the profession, either in your community or around, that you could ask and who they use and who they're pleased with, because it's a struggle finding someone, because sometimes you want someone locally, let me ask you, is it really important that the billing company be in the same city or the vicinity, or can they be all around the United States? What are your
It used to
thoughts?
be really important when we started out. It used to be very important that you were in the same state because the rules of billing is different from state to state. Like Blue Cross has different rules from state to state because we used to be in Rhode Island and they have a whole different set of policies and procedures. New Hampshire has a different set of policy procedures. So to me, the most important thing, like I said, and with the billing service, we try to tell you we are an extension of your office.
Yeah.
We are representing you. And so, so we try in our power, and when we train the account manager, like including myself, I am an extension of your office. And patients could call and complain about you, or I'll be like, oh no, oh no, we're not here for that. And then I would automatically call your office manager, somebody's not happy because when I had surgeons and surgeries went bad, patients would call complaining, and I would give them a heads up that they were going to be getting a phone call. So, I mean, yeah. I am a part of your office. So like I said, and it's a trust issue, and you really have to, that's what I mean. And I have to, in the office staff, we have to really get along, and because we're talking to each other all the time. And as much as we were one time all over Massachusetts, we would make monthly visits to your office just to say hi, just to make sure you're okay. And we also, because the business was started this way, CHM, you have access to us all the time, whether it's by cell phone, me being the manager, me only, not the people, not the 9-to-5ers. Or you can call me on the weekend. I have the system at home. So if you have a question, because lots of times doctors think about something on the weekends, or they're reviewing records, or they're reviewing something, and they'll want to call, and I'll get back to them.
Interesting. So I think we covered that first question, how to find someone or a billing company. The thing is I always get, I feel like solicited on LinkedIn. Everyone from these foreign countries are saying, hey, we can do billing for less, do billing for less. I just get afraid of some of those. Have you heard of those? Like, what's happening?
Yes, we have. Well, it's all outsourced. From what I hear, it's outsourced to India. And again, you are dealing with, I like to be more local with people. We like my software company is in North Carolina, and he comes up once a year. So, I mean, that's a good thing. That's a great relationship.
Yeah.
I mean, and this is what you need to do. You just can't expect everything to be hunky-dory all the time, and the money's just going to keep rolling in. Like I said, it's a level of trust. It really is a level of trust and a comfort level.
Yeah. Now, I think we went over one of these questions, but like, what are some of the questions you should ask the billing company when you talk to them? I think percentage is one, like 8% or less, or things like that.
Well, that's basically the biggest thing.
The percentage, and if they do it all itemized, or if it's just a percentage, right?
Right. That's basically, and the other thing is, I have to know the specialty inside and out. When I go in to do a free consult to an office, or if they're going to call me, I tell them I bring a dictionary that I have. So the ICD-9, the CPT codes dictionaries, I print off something. I ask the office to print me off something to see if we're doing the same codes, or so it's like I said, the only like I said, it's a trust issue. And the other thing is, I ask the doctor when they contact me, why did you think you needed a billing service? And a lot of them say, well, I heard from another colleague of mine, they're getting paid on this code, I'm not, or my office manager's frustrated, she can't do this anymore because she's tied up with the front desk, because the front desk is inundated all the time. So that's basically, Now,
Mo, how do you know if they're doing their job? Like, how do I know, as like, let's say I bring in 40,000 or 50,000 a month.
Okay.
How do I know?
Yeah. Well, the month-end report, when I send you your month-end bill,
I guess the money in the bank, right?
Right. The month-end, and don't forget, mostly everything is EFT, electronic funds transfer. So at the end of the month, I'm sending you, so say for instance, like I said, I start you off, you make 50,000 a month. And all of a sudden if I'm not doing my job, you're going to see, I'm going to train you on the report that I send you. And it's a very basic, it's the accounts receivable aging category, the 30, 60, 90, 120 days, and all the insurances. If I see money past 60 days, me as the billing service panics, because that I should have already received that money, unless we're talking about specific surgeries that require op notes. And again, they have to go in. And now with people working from home, it's 90 days that they're processing a lot of surgeries. So if I'm not doing my job, number one, I'm not getting paid. Well, first of all, you're not getting paid. That doesn't make us look good. Patients are calling. Because it's a lot of billing services just bill the patient. And we see this in the big, like the UMass Memorial groups. We see that, I know, and I've seen that. And so that's efficient. Like I said, it's basically, it comes all down to money.
Now, how do you know, like, this is one thing I've heard of people saying, like, how do I know that you're going to run after the money? Like, let's say it's a $20.
I have to, because I'm running on a percentage.
I know, but you would run after thousands versus 20s, right?
Well,
is that a work ethic thing?
Well, it is a work ethic thing, but also I have a stake in the company. So, and the reports get run sometimes daily, but at the end of each week, we're looking at, the account reps should be looking at anything that's hanging out there. And actually, like I said, it very rarely happens. You have to keep your eye. It's on our end. It's all about the money, because you're entrusting me with your livelihood.
Yeah. I mean, I have to pay my staff. I have to feed my family.
Right. And the only time I would let you know something when is, say, for instance, and these are one of the things, like sometimes around the holidays, Medicare Blue Shield slows down. They'll send out an alert saying electronic funds are going to be delayed till January 10th. And I have to let the physicians know that, because they were counting on that money 2 weeks prior. So these are all the things we keep track of. And that's one less thing. You don't have to think about that. Yeah. And I know what I used to hear from the ladies at the front desk. I'm so glad a patient doesn't have to call me about a bill. I don't want to explain a copay. I don't want to explain a deductible.
Yeah. Now, Mo, what, now having all this experience, and, what are some of the most common problems from inexperienced billing companies or billers that people find? What are the common problems that you may have made 20 years ago when you started doing this that you know better now?
You need to know the specialty inside and out. Yeah. I just can't go walk, because everybody wants the client and they all want the bigger one. We have large and small, and that's why it was is so successful, because the man down the hall who's very small happens to be in your building, and he goes, oh yeah, I know Mo. Oh yeah, or say for instance, you're bigger, and someone will come to you and he'll say, oh, I don't know, I'm kind of small. Give her a call anyway. So we take everyone. And
I like that, those specialty, because if you're doing 10 podiatrists, you're going to get really good at collecting for those 10, versus if you're doing 10 different specialties.
Right. But you see, we're divided into departments. So like I said, I have to know them all, because I go visit all the physicians. And so I have to know all the specialties. I have to know, like I said, the ICD-10s, the CPT codes, when a code is changed. In each insurance, now another thing that physicians don't realize is each insurance company doesn't follow the same rules. They all have their own fee schedule. They all have their own modifiers. Medicare will take RT, LT on the lines right and left. Blue Shield wants modifier 50 for bilateral. Cigna wants something different. It's just, so I mean, that's what you're paying for. And that's what I'm saying. There was I don't think I've not ever refused a client unless, like I said to them, if I haven't done one, like a long time ago, I took on an ENT client. We hadn't done it in a long time. I was very honest with the group. I said, I haven't done ENT in a while. I said, but because of 3 other people in the building, he said, we're going to hire you. And so, like I said, because like I said, I have your livelihood at hand. Yeah. I have that money. It has to come in.
Yeah, that's good. Now, having visited a lot of different practices, and now this is kind of getting on the practice management thing.
Mhm.
You've been in all the different specialties, not just podiatry. You've visited the offices. You see how much they bring in.
Right.
What are the keys to what are some of the best practices, or like the maybe three things that the real profitable practices do differently than everyone else?
Well, first of all, I would say, I think I was telling you, doctor, before, I can go into an office, a clinic setting, and I can sit in the waiting room and I can tell the temperament of that office. I can tell if they're organized, not organized. I can see people running around in the background. I'm going, oh, dear God, you just don't know what's happening. But to me, the biggest bonus to a practice is the communication. And I tell office managers, if you don't want to do a meeting once a week, please do it once a month.
Mm-hmm.
And because the communication comes from the top,
Mm-hmm.
and it has to flow right to the very front, the front desk. I mean, everybody has to be on board, and everybody should be involved in the same, even if, even the same, not decision making as far as administrative end of it, but I mean, everybody
know what's
has
going
to,
on.
right. Everybody has to know, whether there's three of you, or there's, like I said, a clinic, that's more challenging.
Yeah.
But the practices that succeed the most is they really have the checks and balances in place. And that's another thing that I go in and do. If the physician says, gee, I'm working and I'm not getting anywhere, I look at their scheduling. Now, I used to do a cardiology practice where you don't schedule 3 stress tests and then a new patient and then another stress test. You're already 2 hours behind schedule. So you make one whole day all stress tests, and the other day all new patients or follow-up, so the flow is better. So that's another thing. You have to manage the flow of the patients in a specialty.
I agree.
Right.
How about like practice? Let's say you have a podiatry practice A. Let's say it's one doctor produces 50,000, and you have practice B, podiatry practice, one doctor producing like 80,000. What's that delta? What's the big difference in billing within podiatry practices? Why do some guys produce more? Is it orthotics? Is it durable medical equipment? Is it office visits?
It's that, but it's basically, I have a podiatrist right now that just goes to all nursing homes and cuts toenails. Very basic. Then I have another one that does all geriatric, but and he does the same thing in the office, and he does a few excision of toenails, ingrown toenails, and that's about it. And then I have the surgeons. So it's how far you're expanding your procedures.
So the surgeons, you feel that they're billing more? Is that what your experience is?
Oh, absolutely. And of course the reimbursement is much more. Cutting toenails is $48 $48 a patient.
Yeah.
I mean, and so you have to do it like a primary care. You have to do it on volume.
Yeah.
And of course, in a nursing home, that's a very lucrative. I mean, it's a lucrative thing if you want to do that.
You want to do that,
right? It's It's depending on the physician and his specialty. Correct.
Yeah. Now, and if those that are listening, if they want to learn, like, how much do or I'm not saying me, but how much does a doctor need to know about billing? Should they know a lot? Should they know a little? And where do they learn it from?
Well, one thing that I heard they've been teaching it in medical school now. I think there's
we get some billing, not much though.
Right. Because it's not because now what they're turning out is you're going to go into a group practice and you don't have to worry about any of that. You're just going to see a patient, make sure your medical record is, signed, your EMR is all set. That, like I said, that is another challenging question. You should get somebody, if you're going to have somebody in your office that really knows their business. Get someone, like I said, the office manager, whatever title you want to name this person, lead biller, supervisor, whatever. They need to, but again, this is one of the things that we do. In 3 months' time, I know your trend. I know exactly what you do. I know exactly, and if I see you're billing, I'll question something. If you're billing the same office level, a level 3 or a level 4, because nobody reimburses a level 5 anymore. I will do a statistic for you and say, you keep billing a 99213 or level 4, or I'll say to you, Yeah, that's, I lost my train of thought.
Yeah,
Yeah,
and then certain ones are like different procedures, different DMEs.
right.
And
Right.
I think like visiting other doctors or the more experienced, you can learn how to bill, like what is a level 3, what is a level 4, and just getting confident and getting
Right.
back.
It's a guessing game. And also the other thing I pick up all the time when a new patient comes back in and it's, they check it off as an established patient. Well, for me, on the billing service, and I look at the date and I'll say, oh, well, there again, Blue Cross, it considers a new pay after 1 year, you're considered a new patient.
Really?
Medicare is 3 years.
I do everyone by 3 years. I didn't know Blue Cross was 1 year.
Yes. So these are the things that, see, I pick up that trend, and like I said, and the other thing, like I said, when I do, if and when I go into your, well, I think I mentioned that, I repeated it, when I go into your office, that's the one thing I have to have the physicians pick, have them print off the receivables. That's the most important. And then I get a sense of where the practice is at. And if I sit down, whoever's doing the billing, what are their challenges? And hopefully a lot of them are honest with me because they really just want to get rid of it. They just, and like I said, and it's because, I don't know why, because it is detailed, but when you repetitively do the same thing over and over again, you should have very minimal rejections. Like I said, the only time I'm sending out, rejections if the referral didn't catch up to the claim. So that's a resubmittal. Or the only time appeals is the only time I need to do appeals is because of a surgery. The note didn't attach. Normally they don't. You have to send all the claims out electronically. It comes back. They want the note. You have to print off 3 pieces of paper, and then the claim goes to review.
Wow. Well, I think we covered a lot more. I want to thank you for your words of wisdom and your experience. And I think it was helpful for some of the other. I think we covered what this young doctor or this established doctor asked about. So thank you so much for your time. I appreciate it.
Well, thank you, doctor. Have a good day.